Hi everyone, welcome back. I'm Maureen Aquino and I'm a program specialist on the Health and Wellness team here at NRPA. And today I am joined by Robin Brothers with the City of Anniston, Alabama, and Ravi Bose-Adams from the City of East Orange, New Jersey. And Robin and Ravi both come from agencies who are Commit to Health sites and last year were recipients of the Healthy Out of School Time grant. So we're so excited to have you with us today to share some tips and some advice for this next round of grantees on how to make the most of your grant funding and some successes and challenges faced throughout the year. So let's start off by just kind of sharing a little bit about your agency and your role and kind of the programs that you do.
Okay, I'm the center director. I run an aquatics and fitness center. Anniston is a population of 23,000 people, but 87% of our students qualify for reduced lunches at school, and we run about a 32% poverty rate in our area. We ran 4 community centers last summer with a grant, 2 drop-in and 2 enrolled program, and then the recreation center, which was an enrolled program.
Great, thank you. And Ravi, how about your City of East Orange?
I am the program director for the Recreation Food Services, and our city has 65,000 people, with 9,000 of them are children, and 7,000 of them qualify for free or reduced meals. We are sponsors in the New Jersey Department of Agriculture's Summer Food Service Program and the Child and Adult Care Food Program, where we have 52 summer sites and we have 12 after-school at-risk sites.
Great, thank you. So can you tell us a little bit about your experience as a grantee last year, knowing that your #1 priority was to increase meals served? So you can talk about how you utilized the funding to increase the numbers of meals served, or some strategies to engage the community.
We used some of the funds to remodel some of our antiquated kitchens in our community centers, allowing them to serve more meals by having more storage space, some larger refrigerators and things like that. Then we used the Food of the Month curriculum to teach healthy living to our kids and to take home to the parents through nutrition literacy. We really tried to focus on increasing healthy activities. We added a Candy Cane 5K, which is a family-friendly event. We like to send the children home with information and recipes and things like that. It was a really great experience. We learned a lot, and the kids really enjoyed everything we did with the grant.
In East Orange, we serviced breakfast and lunch in our summer food program, and not many kids were coming out into the parks. So we utilized a significant number of the funds to purchase refrigerators. And with the purchase of refrigerators, we were able to expand our program to not only do breakfast and lunch to sites like day camps, but within our parks, we serviced dinners and snacks. And also, we implemented our first ever weekend feeding program, and we were able to utilize the funds to pay the staff. And with that, we increased our meal service by 77%, with 78,000 more meals being served because of the grant funds that came in.
Congratulations.
Yeah,
Awesome.
that's great.
Thanks.
So it sounds like both of you used your funding in part to buy larger pieces of equipment, which is a great way to create sustainable programs. So if you have those resources that can last you year over year, that's a great way to keep the programs going strong.
Absolutely.
So can you talk a little bit more about the programs specifically that you operate, such as your federally funded meal programs like SFSP, CFP?
I'm going to let Ravi answer that. Okay. She's got a lot more experience of that. We actually had a partner that provided the foods for us, and that partnership has dissolved, which is a challenge we're facing, is finding a new partner for the food. So Ravi's going to know a little bit more about the program, the actual food service programs.
Okay, so within the summer food and the after-school meals program, we're able to create a menu. And because our program is so large, we have to go out to bid. So we pretty much had more control over serving healthier food, which we really had not considered until this program came along. Our kids, usually we would give bologna sandwiches, turkey sandwiches, but now we were able to implement salads, more fresh fruit, And again, because of the refrigerators, we were able to keep the contents, you know, at a healthy sanitary level. Also, we put banners all over the city, which help with, you know, marketing. Also, because of the Commit to Health on the website that was talked about earlier, we downloaded a lot of the puzzles and put them into books that we're able to do the activities with the kids when they come to the parks in between meal service. Because within the parks, you're only allowed to do 2 meals. So, and this also works out great after school. Now, with the after school meals, we implemented a schedule. We have motivational Mondays, we have taste testing Tuesdays, we have workout Wednesdays, we have enthusiastic Thursday, and Friday is free play Friday. So we were able to use the HEPA standards both during the week on you know, a given day. And on testing Tuesday, we did the, you know, they tasted the food of the month. We tried to maybe have the fresh fruit or in a recipe, or the kids really liked it.
Great.
We did taste tests too, taste and treat every week, and the kids, that was the biggest surprise with the grant program, is how much the kids enjoyed trying the new foods.
That's great. Great. So Robbie, can you talk a little bit about starting your weekend meal programs and how that worked?
We fed lunch in the parks. Because the vendor couldn't deliver on the Saturday, we had to have the meals delivered day before. So again, the refrigerators came quite in handy in reference to storing the meals the night before. And then the site supervisor would come in on Saturday, and we would advertise all week. You know, with the kids coming out to the park, they would see the meals there all week, and the site supervisor would let everybody know that, hey, we're also here on Saturdays to provide a lunch. Also, with the Saturday feeding, and last year was our first year, we started feeding in an emergency shelter who came on board, 100 kids a day. We were able to feed the dinners to, which, you know, does a lot for your heart to know that, you know, you're able to help in such a manner.
Absolutely. That's great. So can you talk a little bit about partners in your community? So sponsors of these meal programs, or if you do have other community partners, maybe agreements that you have with them and how you've agreed on terms.
We don't have anything specifically in writing that we use with our food service provider. He approached us with the idea that he had the grants through the USDA to provide the food for the children, and he delivered it and handled all of that. But we've dissolved our partnership for now. We partnered with our Boys and Girls Club and another local municipality, and we're in the process of searching for a new vendor to help provide us with the food.
Great.
Because we do have a large program, it's one of the largest, you know, in New Jersey. We partner with many organizations. Our mayor, Ted Green, and under our new director, Renee El Mohammed, we're going to continue in partnering with the East Orange School District. We partner with the East Orange Public Library. Our WIC department, it also is a summer site. Let's see, we have the New Jersey Recreation and Parks Association and the Advocates for the Children of New Jersey. We also partner with United Community Corporation and the Wassessing Conservancy, and again, the Newark Y Emergency Shelter. And I like to think that because we now and forever will use the Commit to Health, that NRPA is one of our partners.
Well, great. We are glad to work together.
And that was a good question that Jerry sent in about a contract or a sample agreement. It would never hurt to have those things in writing if you're able to do that.
Absolutely. So Ravi, you talked about introducing kids to new and healthier foods. Can you talk a little bit about the importance of the quality of food in your programs?
We have, we train our site supervisors to notice when the food comes in, to inspect it, to make sure that everything's okay. And if it's not, to take a picture and notify us in the office immediately, because they are our eyes and ears out there. And if the food does not come in, and you just asked that question, and just today, celery came in and it is not good today. So I immediately emailed the vendor to let them know, hey, you know, this cannot continue to take place. A matter of fact, we're going to switch, because I guess it may be a fruit out of season or a food that's not accessible right now. So you have to keep on top of making sure that the food comes in, and that the kids will like the food, because again, it was celery, which it was hard for us to get kids to eat celery in the first place, and then for it to come in spoiled. It's a turnoff for the kids. So training is the key to that.
Right.
They kind of build on that. The quality of food is very important. The kids, or they're not going to eat bad food. It's hard enough to get them to eat the healthy food. And presentation goes a long way too, I think, with quality. And we developed a program last year to where our lunches came in brown bags. It was like brown bag lunches. So after lunch, after we'd served all the kids lunch while they were in their nap time, some of the staff would stay behind and we would unpackage the food, unpackage the bags, separate everything, and then when they came back down for snack, we'd have a tray of sandwiches, a bowl of apples, a stack of applesauce, and it made it a little more presentable, and they could just come through the line and get what they wanted for their snack time.
Great. And have you seen the increase in quality of food and nutritious food served impact your meal numbers?
It did for us. Our previous vendor, the food would not be very tasty when it would come to us. It wouldn't be great quality, and with the increased quality, we did serve more meals.
Great, great. So how do you market your meal programs? How do you share with the community that these programs are available and you're ready and welcoming to kids?
We use flyers in local churches, through the school system. We do a weekly day camp calendar of activities, and it was on all of our calendars, food program. We did yard signs out front of the facilities, social media, word of mouth, all of those things.
Right. Word of mouth is the best key. We have a group called the Student Ambassadors, and these are our teenage group, and they go around by word of mouth. They're passing out flyers. They're in the park on Saturdays passing out flyers. They implemented a poster contest one time, and had the kids to draw a Commit to Health poster for us, a design, and the winner of the contest received an internship within our office. So we call it Each One Reach a Ton with the student ambassadors. Also, again, I mentioned the banners that we put up all over the place. And in New Jersey, it's going to be mandated that the school districts must advertise a list of the summer food sites that are available starting, I believe, this summer. So that's going to be a great help. Our school district was already doing it, but to be a mandate for all school districts, the word about the free summer food program is going to get out.
Definitely, it'll be interesting to hear how that impacts sites over the summer.
Yes, yes.
And Robin, you had mentioned earlier that you used some of your grant funding to purchase shirts like the one you're wearing and some backpacks.
We did the cinch bags with our logo and the Commit to Health logo. The back of my shirt is actually the large Commit to Health logo. And we use those for door prizes, for activities, giveaways, the attaboys. We like to give the kids a little something if they're caught doing something good. So we use it for that, and it's been very well received, and then the message gets out wherever we wear the shirts or the bags.
Exactly, yeah, so that's a great way to sustain the marketing of the program, is to have these shirts and these bags out in the community and have everyone see them, especially in a great bright color like yellow. So how has your experience been implementing the HEPA standards? We just heard from Daniel and Ava going over the standards. Do you feel like that's helped to increase participation, or has there been a learning curve with that?
Our learning curve was with more the healthy eating portion. We were already focused a lot on physical activity. We have a Be Fit Anniston initiative, and we were already focusing with that group on community walks and starting the day with exercise and things. The healthy eating portion was a little more challenging for us. Parents would bring in food that wasn't very healthy, and it's hard to tell a parent, hey, you don't need to go get your kid a Happy Meal and bring it to this site. But we overcame that with the Tasty Treats, focusing on the food of the month, and the kids got to where they really enjoyed that, so they were eating more and more of our meals.
Great.
For us, one of the difficulties was getting the staff actually to buy in. Not so much the food staff, it's the the recreation department on a whole, because they're used to being able to do hot dogs and cupcakes and things of that nature, and here I'm come along and this has to cut down, if not stop, because we have this healthy initiative. So and even like the exercises that they were doing, I started doing those at all of the staff meetings. And again, at first it was like, oh, not again. But eventually they became used to it, and it was easier for them to do it with the kids once they buy into it. So it took a while, but once the staff is on board with you in reference to committing to health and implementing those standards, then getting the children will be a lot easier.
And staff was one of our challenges too, especially in our summer day camps when we employ a lot of juniors, seniors in high school and college age kids, was getting them to buy in. So what I would do is allow them an off day, but 4 days a week they had to eat with the kids and eat what the kids ate, and then they had an off day. And if they brought something unhealthy, they had to go away from our general eating area to eat it. They could to go to my office or go upstairs to our break room, but they could not eat that in front of the kids. They had to eat what the kids ate.
Did you see over time staff starting to bring healthier options on their off days?
Over time we did, and then it got to be where they didn't like being away from the kids. They didn't like their off time away from the kids. They wanted to be down with the kids eating, so that helped a lot too.
That does help. So how did you engage families with HEPA standards? It sounds like you both had some success engaging the kids and staff. Was there a way that you engaged the full family?
We sent home recipes, and we would encourage the kids to go home and talk about what we did, and we would hear that back from the parents. Parents come in and say, I'm so thankful y'all are doing this. I don't have to worry about my child eating unhealthy food or eating junk food at camp. One little boy loved like cheesecake and that kind of things, and his parents wouldn't let him have it, and we took one of the recipes out of the book and made it with the graham crackers and the cream cheese, and he loved it, and then mom and dad let him have it. So we heard a lot of good feedback like that.
That's great.
We engage families by having events and special programs. Our biggest event is our kickoff event for the summer food program, and we invite all the families out from the community, and they received information on healthy eating. They also received the list of sites that are available to bring your kids to come and eat a meal for free. And we also use that as an opportunity to become park champions through NRPA's Park Champion contest, where Senator Booker sent a representative, Congressman Payne sent a representative, and Senator Menendez sent a representative out to the event and helped pass out meals, to the families. Also, we have monthly, we started having programs like for February is Valentine's Day and it's Black History Month. So we had a One Love for Nutrition event where we invited the families from one of the sites to come out, and we gave out fruit baskets to the families, and the kids quoted African Americans who stated something relating to love and food. And it was a nice event for the kids and their, parents to be at. And we also, again, was able to slip in, healthy food.
Right.
It's an awesome idea. I
That
had
is
to
a
borrow
good-
that.
Yeah, I think building off of events that already exist or creating new events is a great way to engage families and the whole community.
And we did that with our Candy Cane 5K. It's just a fun run. We don't do official times or anything, and we invite families to come out. And we had our after-school programs do posters, healthy eating posters, and they were displayed at the finish line, and they judged the posters and all. It was fun. But we also use social media to engage families by every Friday is Commit to Health Friday, and we'll do something from the Food of the Month curriculum on our social media pages.
That's great. So speaking of Foods of the Month, what advice do you have for grantees to implement the Food of the Month curriculum?
To do it. It's awesome. There's so many activities and recipes and things in that curriculum. If you're ever stuck on a rainy day, there's all kind of puzzles and things that you can do. I took and made a big thick notebook for the summer months. That's when my program at my center goes. So I made a notebook for my day camp director and handed it to her and said, these are all activities you can choose from. You don't have to do all of them, but you've got to do some of them. It's a great resource out there, and everybody should use it. I mean, our day campers loved it.
And the good point is that it's always available. I mean, everything's mapped out for you. All you have to do is just, like you just said, do it. All you have to do is, you know the month is coming up, so the month before, go to the month before and start seeing which mazes you want to pull out, what stone fruit puzzle, you want to do with the kids. And then, the following month, just do that My Plate race.
And put your own twist on it. We have 2 outdoor pools, and our day camp swims at one of them, and two of our camps swim at the same time. So during watermelons, Food of the Month, we took watermelons out, greased them down with some cooking spray, and we played watermelon polo in the pool, where you had to get the melon from one side of the pool to the other one. And in between games, I would shout out facts about watermelons, and you think the kids aren't really paying attention to you to that afternoon when you go back to your center and you're cutting the watermelons, and you're like, okay, the first piece goes to somebody that can tell me something we learned at the pool about watermelons, and they start spouting off those facts back to you, and you're like, okay, they were listening. That was probably my favorite activity of the whole summer, was Watermelon Day.
That's great. And you've both mentioned that you've done taste tests throughout the year. What have been some of the best taste tests? What's the best received?
Salsa was better received than I thought it would be for the kids. I did regular salsa, then I did salsa verde, and then some peach salsas and some corn and black bean salsas. And it was a lot better received than I thought it would be from the kids.
How I was able to get them to even eat celery on a regular basis was the Ants on a Log, which was we used celery, cream cheese, and then raisins. And they didn't even realize that, they were eating, celery. So that was the best one for us.
That's great.
I see a question came up about how often do you do nutrition education at your sites. I think it really depends on your site, the number of kids you have, the ages of your kids. We tried to implement it at least 3 times a week. Some weeks we did a little more, some weeks we did a little less, just kind of depending on our camp activities.
Great. Well, speaking of recipes, going back to that, NRPA has created some great little recipe videos on our website to check out. And we do have Ants on a Log, we have salsas, we've got some fruit and yogurt parfaits. So just some fun, quick recipes that kid tested and approved that could be used in your taste tests.
We did the fruit and yogurt as well, and they really enjoyed it.
Great, good. So any final pieces of advice for this year's grantees?
Keep an open mind
Yes.
and think outside the box. We didn't really have any challenges in our programs, but we had surprises, and it was the kids being so accepting of the nutrition education and the taste test and all, and that was and the exercise. It got to be a challenge as to who was going to lead morning exercise. and who wanted to do this active game, and who wanted to do that active game. So we were pleasantly surprised with the reaction of the kids and the support of our parents.
That's great. And Ravi, how about you? Any advice for grantees or just agencies implementing Commit to Health?
Plan ahead. I think that's the best key for your success within making sure that you're doing everything you're supposed to do in reference to the grant, and so that your staff and the kids can have fun as well. And again, get the staff on board early. That would I wish I had was educated just a little bit more earlier. Had I gone on the website and really dug into it earlier, and it just would have helped out in the long run. So, but it's a great program. I mean, we're not even receiving a grant. However, we're still implementing the curriculum because it's a great curriculum.
And that's the same with us. Even though we don't have grant funds this year, we're still a Commit to Health agency. We're still following the HIPAA standards. We're still following the Food of the Month activities and curriculum.
We're so glad for that. Thank you for all you're doing in the healthy out of school time space. So thanks for your advice today, and all the resources that you mentioned and talked about are on our NRPA's website. So feel free to check those out. We'll just take a quick break and then be back with some more tips.